In this video, I will be demonstrating navigation within a patient's web chart. Whether you are looking at an ED or an inpatient, navigation of the chart remains the same. We can enter a patient's chart through multiple ways. The first is by selecting a patient from your list and then clicking on the chart button at the top of your screen. We can also enter a patient's chart by clicking on their name from your list, from the results of the Find Patients search function, as well as by clicking on a name within the Recently Accessed tab. Upon entering the chart, you will always be defaulted to the Summary tab. The white boxes within the screen are what we call widgets. Widgets essentially act as buckets that pull information from the patient's chart into one place to make it easier for providers to get an overview of their patient without having to click into multiple areas of the chart. They are completely customizable in terms of type depending on the content you are looking for, as well as the placement on your screen. Customization of widgets will be covered in another video for customization of your preferences within the web chart. To the right-hand side, we have our reference column. The reference column houses important patient information and demographics. By selecting the blue eye, you'll get a good summary of patient demographics, their code status, as well as any contact information that is listed on the patient's chart. We can also see that if the patient has been weighed and recorded, the weight will appear on a reference column. In emergency, you will also see the chief complaint of the patient. Underneath this, you can see that the account numbers of the patient, as well as the code status that's been ordered. In Expand Live, you will see a blue link called Historical Links. Clicking on this will show patients' information previous to November 2021 when Halton Healthcare went live with Expanse. Underneath this, we have the search chart function, which allows providers to type in keywords to search for items in the chart if it's been ordered or documented. Underneath this, there are more widgets that are customizable as well. Let's take a look at the tabs of the patient chart. Starting from the top left, we have our Diagnostics tab. In this tab, providers can find results from laboratory, imaging, microbiology, and even pathology. You are able to click on a specific test in order to trend the results and have the option of graphing it as well. In the Imaging tab, you are also able to view DI reports by clicking on the paper shortcut. And in Live, you will have a shortcut to the PACS image right beside the shortcut to the report. Moving over to the next tab, we have our History and Problems. History and Problems is used to view the medical, surgical, family, and social history of a patient. Providers will also be able to see problems that the patient has depending on their diagnosis and medical history. The Provider tab is where you will go to see all consultant and progress notes by different specialties. By default, all notes are sorted by subcategory. This can be changed by clicking on the word subcategory and changing the sort type to whichever you'd like. For example, changing the sort type to activity log will display notes from most to least recent. Please refer to the customization video to learn how to make this change permanent to your user's account. The Administrative tab houses demographic information for the patient. The Activity tab is simply a log of all activity completed on the chart by the care team. This tab is not used very often, and you'll be able to access the information found in this page through other places within the chart. The Nurse Allied Health tab will be where you can find documentation and notes completed by nursing and allied healthcare team. The Other Clinical tab is a handy panel if you would like to see more demographics for the patient, including immunizations and a summary of transfusions in the blood bank summary heading. The Flow Sheets tab, which you may also hear the term clinical panel used interchangeably, can be used to find information that has been compiled, such as documentation, lab values, DI reports, into one table to make it easy for providers to trend data over time. By clicking on the Viewing button, you will see that there are different flow sheets available. Anytime you see a gray star, you will be able to click into it to favorite the option so that it appears at the top of your list. Lastly, in the Medications tab, you will be able to see the medications for your current visit. If you would like to change the view of the Medications tab, simply click on the current visit and select the option that you would like. For example, selecting current infusions titrations will show you all the infusions and titrations that the patient currently has running on their chart. Selecting home medications will allow you to see all of the home medications that the patient has ordered. If you would like to customize the view of your medication tab, please refer to the customization video so that these changes are permanent to your user account. And this concludes navigation of the web chart.